Okay, my name is Anita Adaku Ifejika, an MPH student of Texila American University. My topic is the impact of community antiretroviral therapy in rural areas, a case study particularly in Oran local government area, Akwa Ibom State, Nigeria. Okay, please, can you help me to move up the slides? Hello? Hello? Can you move up the slides? Okay. All right, the summary of this presentation is that community ART has been a benefit to many communities within the states in Nigeria. In Akwa Ibom, for example, is the highest HIV. It has the highest HIV prevalence rate in the country, and also large coverage saturation. That was why it was first chosen for this particular topic, and also being the state where CIDAS project is ongoing. That is one of the FHI 360 project, Family Health International. CIDAS project means Strengthening Integrated Delivery of HIV and AIDS project. Is a project where we render free services to the population. So the objective of this article is to know the opinions of the locals. That is this particular LGA that I chose for this presentation, for this article, to be able to know their reaction and the opinions concerning the community ART that is being rendered to them in their communities. So we also want to know the benefits to the locals, apart from knowing their opinions, and we also the aim also was to make sure that everyone, the awareness is being created and everyone gets to know what it's all about. All right, so that is basically the summary of it. And apart from that, I also ensure that that there is a consent of the locals. That is, they got to give us their consent to be able to administer the question to them. It was going to be based on interview questions. All right. So the results of this interview was analyzed using chart columns, and the outcome, as expected, revealed high positive than negative response towards the implementation of this house-to-house HIV testing to the communities, and is in line. When you hear of community ART, the first organization that brought it in was UNN. It is in line with their 1990 goals, which is to identify the people living, the total people living with HIV get to know their status, and 90% of them get to be initiated or sustained ART, and also 90% of them eventually get their viral load suppressed. So that is really the main goal for this 1990 strategy. And below, if you can look at the screen below, are some of the images we are able to capture with the consent of the participants, of course. Though this here is where the community people are seated waiting for the services to be rendered to them, and to ensure audio and visual confidentiality, we set up a tent so that even the positive ones wouldn't have to feel that stigmatization. So everything was really taken care of. So the community ART project is a strategy initiated by the CIDAS project, that is Family Health International, FHI 360, to improve the efficiency of the service delivery in facilities and also community platforms. This will just enable the coverage of HIV and AIDS services towards hard to reach communities. Those people that cannot come into where they can have access to the health centers, the teams, we call them epidemic control teams, are just there to provide them with all the necessary services they got to receive under HIV and AIDS. However, to further roll out the strategies, like I said, a community mobile team with technical trainings and orientation were set up to provide the quality services and also referrals to the hospital, because you may want the, like, some of the cases we have encountered during this study, we kind of had the ones that were bedridden. So apart from the initiation at the community level, we were able to also refer them to the hospital to be able to, sorry about that, we also we refer them to the hospital to be able to get further treatment apart from the HIV services that is being rendered to them at the community level. So the question here now is, how did the locals react to this new development to their vicinity? Did they accept us? Were we welcomed into their community to be given these free HIV services? The answer from the data analysis is yes, because it showcased a great impact on the community. The opinions, what we heard during the going round, it was really it felt good, like you are touching people's life, and the positive ones, they're being captured, and the ART is being dispensed, and people are getting well, and the communities, they were really so happy with the whole implementation of free HIV and AIDS at the community level. Okay, the background of this study was it has been an integral part of the response to HIV to meet the UN target, like I said before, in order to end the AIDS epidemic by 2013. Introducing this particular community antiretroviral therapy became the ultimate plan to achieve this target. ART delivery system to meaningfully include community-based services will be very, very crucial, as this community system must be resourced and scale up. But achieving scale requires more. That it will demand a transformation on how community-based services will be linked and integrated with health system, not just providing these services at the community level. We're also looking for the linkage rate, how these clients can be linked to the health facility, and which has been very successful during this period of this implementation. That is, such as health system is being confronted with shortage of staff. So by the time they have this pool of clients coming from the community level, and hello, can you hear me? Coming from the community level, the staff will be overwhelmed. So community based, that's another advantage of the community based ART services, because when we when the hospital staff is being overwhelmed with so much work, a referral is done to please to a referral is done to ensure that some individuals are being treated at the community-based level before eventually coming to the facility, that is the hospital. And by then, the crowd that the hospital has at the initial part will be reduced. So that is also part of the advantage of the community-based antiretroviral therapy. All right, the method that I used for this article was through interview, because I needed to relate with the client to know exactly what they feel about this whole thing. Someone coming early in the morning knocking on your door, oh, we have come, oh, we are health workers. We want you to know about HIV. We want you to know your HIV status. And although we do have some negative reaction that people like saying we are harassing them and everything, but with the data analysis and all, we still have higher positive response. Like people were welcoming, the locals were welcoming, both male and female, and they really accepted the
Miss Anita, please do
the
proceed. I
free
guess you are
services.
having some
Okay, if you
internet
look
issue.
at my
Please
result
do
here
proceed with your
from my
presentation, Miss
chart,
Anita.
you could see that from the outcome of the data
Miss
collection,
Anita, can you hear us?
306 persons, 303 persons were
Miss
collated after
Anita?
the interviewing exercise. And based on the charts above, it was illustrated according to sex and age disaggregation. Male and female with the age disaggregation of 14 to 43 years had the highest positive response on impact of the implementation of community antiviral therapy in the community. Using the biostatistic main formula, while 45 to 58 years of both sex argues and condemns the free medical services, insisting that it has been imposed on them, especially being persuaded by family members to participate in this exercise. Yes, I can remember a particular advanced age woman when she made a statement that during their own days, this kind of disease was not there. So why would we have it in this present time? So it was really, it was an experience, truly. Okay. So imposed on them, persuaded by family members to participate in the exercise. They also claim that during their time, as in the back in the days when they were still young with their parents, that such diseases and any kind of epidemic were not in existence at all, and so it cannot be in this civilized age. So overall score was 90% positive response and 10% negative response towards the impact of community antiretroviral therapy to the habitat of Oran local government area, Akwa Ibom State, Nigeria. So in conclusion, with the rate the community mobile team is reaching out to people with HIV and AIDS, the number of individuals already tested and known their status, and with the degree of the counseling, because the what is it called? Effective counseling has really been done. Like we've been doing routine training to enhance our counseling skills so that even the difficult clients that is being tested positive will be able to accept the treatment, basically on the preventive measures. And one cannot but actually see the possibility of the quest to subdue HIV/AIDS pandemic before the year 2030 as predicted by the UNN. So some of the locals did make some statement, like one said, if the disease can be stopped, it will be indeed a good thing for everyone. And that is notwithstanding, we will continue to advocate for people to know their HIV status and practicing the necessary healthy tips that will prevent the opportunity diseases from entering our system. So apart from capturing the positives, you could see the effect it's having on the impact on the locals. Many of them they've said that it's creating awareness. They never knew what HIV and AIDS was before, but now they can even go ahead and tell their friends and tell their family members about it and tell their community people about it. So apart from the free services that is being brought to their doorstep, you can see that is broadening, is enlarging, and many people are getting to know what HIV and AIDS is all about, and everyone wants to know their HIV status. Everybody wants to know the preventive measures to be able to stay healthy and the rest of it. So it was really a good thing to hear. So FHI 360 through CEDAR's project have indeed been reaching and touching lives in one way or the other. So I really want to use this opportunity to thank this organization for that. So for the future steps, I would have want to do inter-local government comparison and also interstate. Let's say since it was 5 scale-up LGAs that this particular study was being done in, I would have want to compare another LGA with this present one. I would have done maybe Oron or Uyo being the capital city of the state. We'll compare it with the other local government to be able to really feel the impact of the community ART on the community people. And also apart from the local governments, I also want to do that of the interstate, like comparing, let's assume Cross River and Akwa Ibom, or maybe Akwa Ibom with River State, to be able to really know how far community ART have gone, how far, how well the locals know about HIV and AIDS, as in how broadened is their knowledge. Those are the kind of things I really want to um, look at, to be able to have those people's view, because I believe it will aid to create awareness of the free services. Thank you.